At Harbor-UCLA, it's a level 1 trauma center. It's one of the safety net hospitals, so it helps those who really often have no other place to go. And because you have to deal with just that wide breadth of patients, you're really good at just treating everybody with respect, everybody as if they're the only patient you're going to deal with.
Harbor is a busy level 1 trauma center. In addition to being a trauma center, we are a safety net hospital, giving our trainees unrivaled hands-on clinical experience. We have an enthusiastic and supportive faculty who love teaching residents and fellows.
So our patient population is very unique. Lots of our patients are very underserved, and lots of them have multiple comorbidities. So although they're difficult to take care of sometimes, it's not only a great learning experience for us, but we're also really doing something for people that need it the most.
Yeah, this is a small hospital, and the program's small too. So we are like a tight-knit family, and I think a lot of residents like that because it's kind of intimate. So everybody knows everybody. I know all the residents by name. I know their interests, and they all know me by name, my interests, and also because it's a small program, nobody's getting lost in the cracks. So we know if they're lacking anything in clinical skills, we know where to focus on. If they're lacking anything academically as far as having difficulty passing exams or whatnot, we know how to improve on those.
The residency program provides many opportunities across a gamut of different subspecialties. The rotations that we have and how we've set it up in a tiered approach, they get progressive responsibility throughout their 4 years. My priority as a program director, I want to see all the residents succeed and pass their exams and become board certified.
So one of the greatest things about Harbor that I like particularly is that it's a small program and it has a very good sense of community. That was something that I was looking for when I was interviewing as a medical student. I wanted a program where you kind of fit in as a family. And here at Harbor, it's very apparent that you're immediately kind of embraced and brought into this small community of physicians working together.
So we actually each get assigned a mentor early on, and that's kind of our go-to person. But it's funny because already 2 other attendings have come up to me and said, I know you have a mentor, but if you ever want to talk, like, we can talk too. And I think that's a very welcoming thing that really reflects our department.
There's a few main reasons that I chose Harbor-UCLA. The first one was I could just tell the environment here was a good one. People enjoyed working here, people enjoyed coming to work, and overall it's been a great experience. I also love living by the beach, which is a big perk of working at Harbor-UCLA.
I think the work-life balance here is great. When you're not working, you get to do a lot here. There's Southern California, it's a great appeal, great draw for a lot of people. I like to play basketball, I like to go to the beach. I know a lot of people like to go surfing. I think you have a diverse set of things you can do here, and it's kind of unlimited possibilities. So we have different types of learning here. We have our clinical learning that we have in the OR, in the operating room, as well as the learning that we have in the classroom. I think the most of the learning that we get is in the operating room, just because we have a dynamic environment in the OR where there's a lot of things that are happening, and you can kind of learn from each patient.
The trauma at Harbor is unparalleled. You get some very, very extreme cases here that you probably won't get anywhere else. Being able to handle anything that comes in the door here, you'll be able to handle anything out in the real world.
In terms of opportunities after Harbor-UCLA, something that I looked into personally is when I was applying, I noticed that most of the residents matched at top fellowship programs across the country. And that was appealing to me because I know that when I finish at Harbor-UCLA, I also want to continue my education somewhere that is top-notch.
With our outstanding faculty, the facility itself, and the unique, diverse demographics, I know we can offer the trainees in anesthesiology an education and training second to none.